Hello, hello, hello. You're welcome to the Health and Wellness Hub. Welcome back to the Health and Wellness Hub. We are glad to be back here to give you all the health tips and all the help advices from our seasoned and well experienced professionals. So you're welcome back. We'll just play music for 1 minute and then I'll come back and introduce our special guest in the studio. So don't go anywhere. Share the link, invite a friend, invite a family member, invite everybody, because the topic for today is sleep disorders. And I know we all go through that in one way or the other. So share the link, invite somebody to come listen in. You never know the life you're saving. So don't go anywhere and stay tuned. We'll be right back.
Hello.
Hello, welcome back. Welcome back. This is the Health and Wellness Show, and my name is Miss Jill. We're glad to be back on your screens, and we're going to be talking about very, very important and interesting health topics this season. So stay tuned. Don't go anywhere. Please share the link, invite a friend, invite a cousin, a family member, your wife, your children. Healthcare, concerns everybody. Everybody has a health problem, or we all need advice. We all need to listen to healthcare issues and stuff. One way or the other. So please, please, please invite everybody. You never know the lives that you're gonna save. Just one word or just one clue is gonna save a life. So please invite everybody anywhere in the world to come and listen to what our professional and seasoned healthcare professionals will be, the advice and information that they're going to be giving us on this show. So welcome back. We're glad to be back on your screens. This is the Health and Wellness Show, and my name is Miss Jill. I'll be your host. Davi Sarah is not here with us because she's taking care of our family matters. We just want to send them our condolences, and once she's done with all that, she'll be back here on the screen to help us with our segment. So thank you all for listening in. Thank you all for watching us. As I said, today we're going to be talking about sleep disorders. And our guest for today is he's not he's no stranger on this show. Yes, he's always with us. He's always willing and comes with joy to share with us. He's a seasoned and professional doctor. His name is Dr. Kenneth Kafui Afenya. He completed medical school at the University of Ghana before moving to New York in 2004, where he completed his internal medicine residency at the Brooklyn Hospital Center. After residency, he relocated to Tennessee, where he served as the medical staff president at Baptist Memorial Hospital in Tipton. Dr. Afenya later moved to Lexington, where he completed his nephrology fellowship through the University of Kentucky College of Medicine. So you can all see or hear from what I just read from his biography, or from that he is well experienced. He's been all over the place, from Ghana to the US. So today he's going to be talking to us about sleep disorders. Dr. Afenya, you are welcome. Welcome back to the Health and Wellness Show.
Thank you very much.
We're so glad to have you.
It's a great pleasure to be here again.
Yeah, and it's our pleasure to have you too.
Thank you. Mm-hmm.
Yeah. So I'll just throw it over to you, and then take us through the sleep disorders.
Okay, good. So there are so many things that we take care of as health, and one of the things that people talk about is basically you want to look at exercise, you want to look at people talk about diabetes, talk about hypertension, and they talk about so many things. But one of the areas that we really don't talk about is sleep disorders, because it doesn't come up. And unfortunately, it affects all of us one way or the other. If you are a student, if you are a mother, if you're a father, you know about it. You know about how you go to sleep and you lay in bed and you're tossing around and you're like, I'm going to wake up at 5 a.m., but it's 1 a.m. and you can't sleep. And you're asking yourself, what exactly is going on? So it's because we don't talk about it so much. That is why. And so my focus is going to be on sleep. Why is sleep important? Why do we have to sleep at all? And then what the type of sleep that we have. And then after that, we will go down and break it down into the various type of sleep disorders that we have. So why is sleep important? I'm sure you have so many things going in your mind. Oh, what is this topic? Sleep. But if you are true to yourself, every one of us would need some form of sleep or the other. And so our body is designed that as you work throughout the day, you have a time that you have to go to sleep, so for the body to build the system back and get it ready for the next day's activity. So, one, there are two main types of sleep, and it's divided into what we call the REM sleep and non-REM. REM sleep and non-REM. In fact, the non-REM sleep comes before the REM sleep. Non-REM sleep basically is a period that you go into bed and then you realize that you have some jerky movement as if you're about to enter into deep sleep. The initial part where you have some consciousness, you go and then you enter into what you call the REM sleep, where you go deep that you're not aware of your surrounding anymore. And that is called the REM sleep. REM sleep is when you can have dreams and things, because you go into deep sleep, you really have to be shaken. So for you to wake up out of your REM sleep. So that is deep sleep. That's called a REM sleep. Now, how much sleep do we need for us to be okay? Typically, for us young people would need about 6 to 8 hours of sleep. The older you get, the more difficult it is for you to fall asleep. So you see that if you take young people 5, and no matter what you do, if it is time for them, you force them to go to sleep. But if it is truly time for them to go to sleep, they will fall asleep wherever they are. It could be in the bars, you could be in the watching TV, they will fall asleep and go to sleep. And they will sleep 8 hours at least. And the older you get, it is more difficult for you to sleep. So then you'll be getting about 6 to 7 hours of sleep, and that's okay. So those are mainly how much sleep you need. Now, I want to break down the type of sleep disorders that we have. The first one is insomnia. Insomnia is inability to fall asleep. And insomnia is divided into two main parts. You can have where you have difficulty falling asleep, or you sleep and after 2 hours, you wake up and then you can't sleep anymore. So you have initial and then late kind of insomnia. And there are people who had that degree of insomnia. They find it very difficult to go to sleep after they've slept for maybe an hour or two. Then we have what we call sleep apnea, which is after the insomnia, we call it sleep apnea. Sleep apnea, there are two main types of sleep apnea. We have one that is called the central sleep apnea, and then obstructive sleep apnea. Central sleep apnea is when you have the situation where your central nervous system, one way or the other, have difficulty falling into deep sleep. So what will happen is that you have somebody, he will go to sleep, and after 1 hour, he will check and then wake up because there is some abnormality in the central nervous system that is impaired, leading to the person's inability to fall asleep continuously without waking up. So you see that this person will wake up 3 or 4 times in the night. Sometimes when it happens, he or she will not be able to sleep for a long time. Now, as opposed to obstructive sleep apnea, which has the term obstructive in it, meaning that there's something blocking your airway. Now, normally, when we breathe, we inhale oxygen. Our body produces carbon dioxide, which we have to get rid of. Now, when you have either by means of asthma, or you have some form of obstruction, sometimes obesity where your neck is short, and then because of fat deficit, it is difficult for you to get rid of the carbon dioxide. This carbon dioxide builds up in your system. So at night, what happens is that the buildup of the carbon dioxide will then wake you up, and then you're not able to have enough sleep. What are the symptoms that happen? So you see that some of these people with either central sleep apnea or obstructive sleep apnea would have daytime sleepiness because they've waken up so many times at night that they didn't get enough sleep. And it is very risky for people who operate machineries, like somebody who is a truck driver, or he's a school bus driver, who have either central sleep apnea or obstructive sleep apnea, to be able to function well during the day. So when this happens, you see that they would not have enough sleep, and then they will be sleepy at night. So those are the main things, talking about insomnia, central sleep apnea, and obstructive sleep apnea. I want to pause here and take any questions, and then we'll come up to the second part if there are any questions or any things that you want me to clarify about.
All right, thank you, Doug. So as Doctor said, if you have any questions, if you have any comments, please put them in the comment section, and he will be happy to answer your questions. Thank you, thank you. Please share the link as well. Share the link and let people listen in and pick 1 or 2 advices or something that's going to help them sleep better. I mean, sleep apnea happens to all of us in one way or the other. Sleep disorders, in one way or the other, we've all experienced it. So it's something that we all relate to. So share the link, invite people to listen into it, and ask questions. If you have any personal questions or any general questions, kindly put them in the comment section for Doctor to answer. Thank you.
Okay. All right. Okay. So whilst we wait for the question, I just want to say that this kind of pattern of sleep disorders, now, what are some of the things you can do to help to have good sleep? So one of the basic things that you can take care of is called what we call sleep hygiene. Sleep hygiene. Sleep hygiene is just like we have dental hygiene. Sleep hygiene is taking cognizant of the fact that you need sleep and making time for sleep. So for instance, you can't be that one where you know that you have to wake up at 5 a.m. to go to work at maybe 6 a.m. And then you stay all along and go to bed maybe 2 a.m. No, that is not good. Slow sleep hygiene, meaning that you have to know that I need 6 to 8 hours of sleep. So you make time for that. So you gather yourself and said, okay, I have to go to bed at 10 p.m. So every night, 10 p.m., you make sure that you go to bed. So that's what it calls sleep hygiene. Now, apart from that, there are also what we call distractors. So there are a lot of things that can distract you. That is watching maybe TV, watching excessive TV, or being on your phone and thinking that, oh, let me go to sleep, but you're on the phone. You can't stay on the phone by the time you realize it's 2 a.m. because you've not given yourself time to fall asleep because you are still stimulating your brain because you haven't given yourself enough time to sleep. Your TV is on, your TV is in the bedroom, and you're not getting enough rest. The second thing is taking excessive stimulant. By stimulant, I mean coffee and other stimulant, alcohol, and those things. So those things can keep you awake. For instance, if you know that you're going to go to sleep around 10 p.m., then you should not drink excessive coffee during the time that you're about to fall asleep because you know that the stimulant will keep you awake. So you avoid those things that would impair your ability to fall asleep. That's number two. Number three is the time that you eat before you go to sleep. Let's assume that you know that you have to go to sleep at 10. You have to give yourself at least 3 to 4 hours for the food to digest in your system before you can fall asleep fully. So you have to give yourself enough time between the time you eat and the time you go to bed. The fourth thing is sometimes during sleep, you realize that because you haven't had prepare yourself in terms of getting yourself ready, you don't have that amount of sleep that you need. Now, the fifth thing is that when you have good sleep hygiene, you should apportion your time such that you sleep only in the night and don't avoid taking too much naps. There are some people, they will come to me and say, oh, doc, I haven't been able to sleep. A couple of days ago, somebody said that. And then I said, okay, what do you do during the day? So if you sleep excessively during the day, then you don't, your body has had enough rest and then you'll be awake during the night. Now, if that is what you do, that is different. Within the period of 24 hours, just make sure that you're getting that 6 to 8 hours, especially healthcare workers. Healthcare workers have no choice because they have to work at night. So they're getting enough sleep during the day. Now, the sixth thing is when it comes to health workers who work at night, then you have the tendency to sleep less number of hours during the day. The other way to make sure you're getting good sleep and get a good sleep hygiene is to sleep in a very dark room. So I remember some days past when I work night, I have to have like dark curtains and make sure all the rooms are closed and the room is really dark, because that is when your body is able to rest well. Take note, the body produces what we call melatonin. Melatonin these days, we have melatonin that they prescribe for people, and it comes in milligrams, like 3 milligrams, 6 milligrams. Some people go to the extent of taking a 10 milligram melatonin. Now, melatonin is a natural substance that is produced by the body. The way the body produces melatonin is if you have a dark environment. A dark environment, your body produces melatonin, and that helps you to go to sleep. And so now we found out that, okay, if you're producing it naturally, we can have a melatonin that we can manufacture, give to you, and that will help you with your sleep. So that is basically a sleep hygiene, making sure that you create the necessary environment and necessary activities that will help you so that you can fall asleep well and get good rest. Okay, so I will pause here again and allow people to ask any question, and then I'll come back to pharmacological treatment. What medicines can we give you to help you sleep?
Okay, so we have one question here from Azala Suvivi. Okay, so it says, Doc, what is the cause for falling asleep after a big meal like banku? I have experienced this lately. Sleep hits me like a ton of bricks after eating banku and okra soup.
So that is a very good question, and I know everyone on this platform will attest to that. That whenever you eat, then sleep will hit you. That's true. Now, this is what happens. Whenever you eat, the food has to be digested. So the body now, realizing that the food needs to be digested, will pull all the blood flow, to your intestine, because the intestine needs to work now. So what is actually happening is that because of the pulling of blood to your intestine, there is decreased blood flow to your brain. That decreased blood flow to your brain makes you sleepy, and it's a very common phenomenon that happens, especially if you eat a very high carbohydrate diet, like cocoa and banku and fufu. Those things can happen to you, and I think all of us here can attest to that. When you have an exam coming the following day, and you had a big fufu, and now you can't stay awake to study.
So, Doc, let me ask a related question. So, in that case, is it advisable to eat those kind of heavy meals? Like how many hours do you need to eat that before your sleep time?
Good. So now, what that means is that, for instance, you cannot eat the banku or fufu and go to sleep immediately, even though the sleep attack comes on you as if you're ready. Now, you still have to give yourself at least 3 to 4 hours. Your stomach needs to be empty before you go to sleep. If your stomach is full, you have a tendency of developing acid reflux, which is called gastroesophageal reflux disease, because what is happening is that between your stomach and the esophagus, you have a sphincter. The esophagus is the food gut, and then the stomach. You have a sphincter. If you continually eat and sleep on full stomach, you have the tendency to destroy your lower esophageal sphincter, and eventually you can develop esophageal reflux disease. Those who have reflux, typically, we ask them to avoid going to sleep immediately they have eaten. They have to give themselves at least 3 to 4 hours, because that's the period that whenever we eat, the food stays in the stomach for 3 to 4 hours because it has to be churned and mixed and churned and mixed that long. And after that, it is released small by piecemeal into your small intestine. So it's very important, even though the sleep comes on you, if you do active movement or trying to engage yourself doing active, you will impair that attack or sleep that comes until you are fully ready to go to sleep.
Okay. I have another question. There's another question too. So sometimes you have your full like sleep hours, let's say between 6 to 8 hours of sleep, but then during the day you still feel lethargic. Like what causes that?
So basically, our body, like I said, you need that 6 to 8 hours of adequate sleep. Now, sometimes during the day, you may have occasional episodes that you're very sleepy, you're very lethargic. I'm sure you will attest that you probably did not get that 6 to 8 hours of sleep if you can be truthful to yourself. Sometimes we say, oh, I slept well, but you probably, didn't do all the things that check the boxes well. In any event, you can have instances where you're truly tired and you're lethargic, or you have just eaten the meal, like I said. And that lethargy, most people, if you had adequate sleep, usually come after lunch when you have eaten. And that same phenomena is what applies, that you have your body now listening to the intestine by pushing blood to the intestine instead of to the brain, and you have that lethargy. Those lethargy comes, or altered mental status comes, when you have impaired blood flow to your brain. It is not like significant impaired blood flow, but low enough that you start feeling lethargy and you have that sensation of drowsiness and sleepiness. So that's what happens.
Okay, thank you, Doc. And
Okay.
another question is let me see. Okay, I don't see any other question here. Okay, so Doc, you can continue.
Oh, great.
Yeah.
So now we'll come to pharmacological treatment or other therapies that are available for sleep disorders. The first one we're going to talk about is how do we treat insomnia? Insomnia is when you go to sleep and you can't fall asleep at all. So there are a few medications. I mentioned one during the commentary about the body producing melatonin. So melatonin is naturally produced by the body, but we can manufacture it and give to patients. So melatonin is usually the first medicine that we prescribe. And usually you take the dose and then it helps you fall asleep. We have other medications like Ambien. I'm sure some people have heard about it. You get Ambien and you take it, and that helps you to fall asleep. Now we have others like benzodiazepine. You've heard about it before, something like Valium, those three. So three main medicines that we use in insomnia: melatonin, Ambien, and then sometimes the benzodiazepine. The most typical example is the Valium that we use. Now, then we come to obstructive sleep apnea, or what we call the central sleep apnea. What do we do for those cases? Most of the time, if you have a sleep apnea, you have to go to a place where you can have a sleep study. You have a sleep study. So this sleep study, your doctor will ask you to go to a lab where you will be there overnight. So overnight, they'll put electrodes on your head. The electrodes will study your sleep pattern to see how many times did you wake up during your ability to fall asleep. And those are measured and they'll come up with a score. Based on that, you can be given a CPAP. CPAP stands for continuous PAP. You can have either a BiPAP or a CPAP. What that means is that you give you a machine that you push around your nose that will help you either with breathing, where it help you with inhalation and exhalation. And some people do very well, and that helps them sleep throughout the night very well. And so depending on what you require for your obstructive sleep apnea or central sleep apnea, they can give you a CPAP. I don't know, there are people who are on sleep app. So those are the two main ways by which we help people who either have insomnia or have a sleep apnea. And if you have sleep apnea and you're having difficulty driving, I would suggest you go to your doctor, get a sleep study, get a CPAP, and that will help you, especially when you have a lot of daytime sleepiness and you don't want to be involved in an accident. And so because you didn't have enough sleep, that is why that happened. So basically, those are the main things. So in summary, sleep is very, very, very important. You have to give yourself enough time to sleep. You have to go through all the necessary things I talk about regarding sleep hygiene. Sleep hygiene, all the things I talk about, making sure that the room is very dark, making sure that you give yourself adequate time, making sure you take away all the distraction, avoid all the stimulants, and eating and giving yourself enough time from the time you had your meal and the time you go to sleep. If you do all these things and it's not working, then you can apply the pharmacological means where you can go to a doctor, talk to them, they can prescribe you some medicine. And if that is not helping, you can get a sleep study. If you get a sleep study, then you can qualify to get a CPAP. So basically, that is the summation of sleep disorders. And I hope this has helped you enough. But if you have other questions or come up later, you can always reach the host and get back to me, and we can see how best we can answer all your pertinent questions. Thank you. Thank you very much for giving me this opportunity. Thank you so much.
All right. Thank you, doctor. So that's one more question. So do you have any tips? Sometimes when you sleep and then you wake up in the middle of the night to go use the restroom, you come back and you struggle a little, to fall back asleep. Do you have any tips for us?
So again, that happens to all of us. I'm not particularly sure if there's any tips that can help, but again, it is trying to take away all the distraction once you come back from using the restroom. Make sure there are no TV is not on, your phone is not on your side, and so that you can go to sleep again. And I know it happens to all of us. Yeah.
All right. Thank you, Doc. Okay, we have a comment here from Victor Doe. He says, "Thank you for this important subject. It does affect us all greatly, especially at our advanced age when our bodies function at reduced capacity." Very true.
Yeah. Mm-hmm.
And there's another question from Mr. Lawrence Dagadu, DJ Mawenyega. He says, "Doctor, as a senior citizen, I have to have a nap in the afternoon. If I don't, the rest of my day is messed up. Is this normal?"
Yes. In fact, I gave this talk to a different group, and that question came up. And what it means is that make sure that within the 24 hours, at least you're getting the 6 to 8 hours. So if your nap time is 2 hours and you are still getting your 4 hours at night, and you get 2 hours during the day, that is still adequate. So that should not stop you from taking your nap. Take your nap well, and don't be discouraged if you don't get enough sleep during the night, because remember, you have to remind yourself that you got 2 hours during the day and you're only getting 4 hours, and be happy with it, because you don't expect to get 2 hours during the day and expect to be able to get 6 hours or 8 hours at night. Your body will not take it. It will say, "Oh, you've had enough." The other secret is that if you don't sleep, and you stay awake for a couple of days, your body will take that amount of sleep. Either you get sick or something will happen that you fall asleep so much that you recover the number of days that you haven't slept. So your body has a way of demanding for that sleep. It's just like you stay awake the whole night and thinking that you still be able to stay awake during the whole day. Your body will automatically be, demanding, "Hey, I'm ready to go to sleep," and you have difficulty staying awake. And
We can't
focused.
cheat nature, right?
Exactly.
Yeah.
Exactly. So just make sure that you're getting the amount of sleep you need for the 24 hours, and you should be fine. So you can still take your naps during the day.
All right, and thank you so much, Doc. I don't see any more questions there here. So yeah, I don't. So in a nutshell, Doc has given us the reasons why people or we go through all these sleep disorders. And I know he said one thing that I have taken, we just have to, we need to observe be disciplined with our sleep time. When it's 10 p.m., it's 10 p.m. You shut down and then give your body that amount of rest it needs, so you will be rejuvenated the next day to go about your duties. So we really have to be disciplined, especially with our kids. School going age today really need bedtime. They need a routine. So thank you so much, Doc. Too soon. We've come to the end of the show. Yes. We've come to the end of the show. As I said from the beginning, Dr. Apenya is no stranger on this show. Right from the onset of this show, the very first show, he was with us. We went on a break and we are back. And on our comeback show, he's the very first person to be with us on this show. Thank you so much, Doc. We really appreciate you. And we know he's going to come back again with some great healthcare tips for us. Thank you, Doc. At this moment, we want to thank you all so much. Thank you for listening in. Thank you for watching us. This is the Health and Wellness Show. We'll be coming your way with very interesting healthcare topics. So please be on the lookout. Next week, we're going to come on the show. Please share the link, invite a friend. You never know the life that you're going to save. Somebody might just come on the show, just listen to just one tip, and it's going to save their life. So please, let's not take it for granted. It's healthcare. It affects everybody. Everything affects everybody when it's healthcare. So please. Thank you all so much. We appreciate you. My name is Miss Dell, and we'll see you again next weekend, same time, 9:30 a.m. Eastern, 9:30 a.m. Central Standard Time, and then 10:30 Eastern Standard Time. Yes. Yeah. I mean, in Ghana, I think it would be like in the afternoon, right? Like 3 p.m. or sometime in the afternoon. So please, anybody in the world can watch this show, listen in, send the link. It's on YouTube, our channel. Just go to Siana Eweland. Just share the link. They can still watch it later on. So we all benefit from it. This is the Siana network. We have other shows that run. Friday, we have DJ Mawanyega. He comes our way with African jazz music. Yes, very interesting sessions. And then Saturday morning, we are here 9:30, the Health and Wellness Show. Yes, we're here always for you. 9:30 Central Standard Time, 10:30 Eastern Time. And then after, there's the Siana Talk Show. FO Steve and Empress Mousy come our way very soon. Once we leave here in some few minutes, they're going to be on the show. So please listen in as well. And then afterwards, we have the Duyenyo Bobobo show that comes on afterwards. And then later on during the day too, we're going to have the Strong Begbe. Yes, Strong Begbe. We need to learn our Begbe language. So, yeah, that's about it for Saturday. And then Sunday, our sister Nicole also comes to us with Afrikuchio. So basically, that's about it for the shows on this network. Please, 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 as I said, continue to share the link, invite people to listen in. I mean, we all know when you go for consultation in healthcare, we know how expensive it is. But on here, when you come, it's free. It's free consultation. Who doesn't want free consultation? So we thank you for watching us. We'll come your way again next weekend, same time. See you and stay blessed. Bye-bye for now.
Bye-bye.
Bye. Thank you, Dad. Bye.